moderator, Almita Cooper. I'm with Moms Clean Air Force National Team. Our intention today is to help our audience better understand the connection between clean air, climate, health equity, and inequity, with a special focus on Black maternal child health. And now I would like to welcome our special guest, Congresswoman Joyce Beatty. She is the Congresswoman for District 3, my former Congresswoman, and she is also chair of the Congressional Black Caucus and Mom Clean Air Force 2022 Women's History Month Climate Champion. Welcome, Congresswoman Beatty. Thank you for joining us today and to share a special message with our audience and the panel about the importance of Black maternal and child health and its connection to clean air and climate change. And perhaps, Congresswoman Beatty, you will comment on your observations about what you hear from your constituents locally and nationally and at the level of the Congressional Black Caucus. I'm especially interested if you can comment on the Black Maternal Health Momnibus Acts of 2021 and the harmful connection between climate and its impact on pregnant women of color as reflected in the Protecting Moms and Babies Against Climate Change Act, which is a part of the Momnibus Acts. Congresswoman Beatty, welcome.
Greetings, but first let me just say what an honor it is to be here today and to thank Almita Cooper, my dear friend, for that gracious introduction. I can't help but saying I am so honored and proud of all the work that you're doing with Moms Clean Air Force nationally and what we're doing right here at home in Ohio in the 3rd Congressional District. So many partners with the Congressional Black Caucus. Why is this important? It is so important when we look at how clean air affects a young pregnant mother, how it affects us as we look at all of the issues with maternal health care. Certainly we know when we look to the United States, the maternal death rate already worse than any other high-income country. We also know that Black women are 3 times at risk for death. As the chair of the Congressional Black Caucus, I am so honored to say, for the first time in our history, we have 4 nurses who are members of the Congressional Black Caucus. And our #1 issue when we talk about healthcare, especially during COVID-19 pandemic, that we must look to how we can improve the United States maternal death rate. We know there are things that we can do better. We know education and awareness is so important. But as we are in this new era of time, we must look to what are the factors that are at risk and what are the things that will have the greatest impact for us making a difference. So when I think about what we can do, I think about these 4 things. I think about the imbalance when it comes to racial justice, because we know young Black mothers are at a greater risk. I also think we have to think about the economy and how that has an effect on quality healthcare, quality and affordable education, and community programs that we can be engaged in. And then we have to strengthen our healthcare practices, especially with COVID-19. And lastly, but of great importance, is how we are experiencing and how we deal with climate change and how important it is for us to have clean air. I can tell you firsthand that this was a top priority, not only for the Congressional Black Caucus, but for me as a grandmother, as a member of Congress, and as a female. It was so important that when we were putting dollars in to our plan to build a better America, that at the top of our list was making sure that we put funding in for clean air. What we put funding in to remove lead from our water. All of these things are so important as we go into this new era of COVID-19. As we now know, right here in Columbus, Ohio, Alameda, a community that you lived in, led in your professional work in healthcare, that only a few years ago, we had the highest death rate for infant mortality. Well, we've heard the saying, it takes a village. And it took a village of individuals like yourself, individuals like Tracy, who is with us today, that has a long history of not only fighting against the death rate from maternal health, or maternal health and births, but with cancer. So many things that we have learned from in our past that it takes the legislative process to have legislation like Momnibus, to have a member of Congress, Lauren Underwood, who teamed up with Alma Adams, and to have a congresswoman like Robin Kelly from Illinois, who is the Health Brain Trust and has put this at the forefront of our agenda. And if we are going to really talk about partnerships, if we are really going to talk about making a difference, we have to start, yes, at the national level. And that is why we are so grateful that you have been innovative and creative to tell us that clean air is a part of what we must look at if we're really going to affect changes in our birth rates when we look at where we are today. So what are some of the things that we know? We know if you are exposed to not having clean air, that it has a direct effect on everything from early births to low birth rates. And research tells us that. So how do we counter that? We do that with messages like today. We do that by supporting Mom's Clean Air Force. We do that by educating not only our young mothers, but other organizations, professionals, business leaders, country leaders, that the importance of us marrying the work of the Clean Air Force community with our healthcare communities, with our social work community, and yes, with our civil rights leaders, because this is something, if we're going to move the needle, it takes a movement. And I am so honored to be a part of that movement. I am so honored that we have partnered through the Congressional Black Caucus, through my legislative office, and right here in the heart of the nation, in the Midwest, we have also partnered with organizations like Celebrate One that brought together young mothers, stakeholders across the entire spectrum. And that is what this message is about today. It is about letting the nation know at a national level and right here in communities like Columbus, Ohio, but also in communities across the country. With the Congressional Black Caucus, we have 59 members who cover from the far east to the west, to the north, to the south. And we know the disparities when we look to communities that are of low economic means, when we look to communities that have heavy minority populations, especially Black Americans, because we know that disproportionately when it comes to healthcare, when it comes to education, we are in those numbers. So today, we send a strong message to the nation. Get on board with us, because Mom's Clean Air Force joins with organizations across this America to build a better America. Thank you so much for allowing me to have a small part in such a strong message today.
Thank you, Congresswoman Beatty, for those insightful comments, and we really appreciate you making time to be with us today.
And thank you again for bringing this to the nation's attention and for continuing to be a leader in what we're doing. So let me just end with say, I support Mom's Clean Air Force. Join me. It's making a difference.
Thank you, Congresswoman Beatty. Also, I would like to make a comment that I notice as I talk with people in different states and different communities is that although they may acknowledge climate change, they struggle with what climate change means to them individually and how it impacts them now and in the near future. Climate change is a significant threat to the health of mothers and children, and especially mothers and children in vulnerable communities. You saw earlier on your screens the statistics that Dr. James provided in the introduction to our program today. I also want to keep those facts in mind, as well as some additional facts that I think will help you as we have our conversation. First, impacts from climate change on extreme weather and climate-related events, air quality, and the transmission of disease through insects and pests, food and water increasingly threaten the health and well-being of the American people, particularly populations that are already vulnerable. These facts were gleaned from the fourth National Climate Assessment that was first mandated by the US Congress in the Global Change Research Act of 1990. Also, you should know that by the year 2100, summers in Cuyahoga Valley National Park in Ohio are projected to be 13 degrees hotter. Since 1990, an average of 135 Ohio citizens per year die from asthma. Adult women and Black residents are significantly more likely to die of asthma, and almost all asthma deaths are preventable with appropriate medical care. And last but not least, in April of this year, the 2022 American Lung Association Annual State of the Air Report was issued. They found that millions more in our country are breathing unhealthy air compared to just a few years ago, in large part due to climate change, which is also widening the nation's health disparities so that people of color face disproportionate exposure to unhealthy air and the associated health risk. According to the report, ozone pollution is linked to 50,000 US premature deaths each year. And now I would like to turn to Dr. James. He's going to highlight some of the important facts about U.S. maternal and infant morbidity and mortality, and really set the stage for us as we have our further conversation. Dr. James, I'm going to turn the program over to you now.
Thank you very much. It's my pleasure to be a part of the program and this important work. I have several slides I'd like to go through to introduce some data with an emphasis on maternal and child health. I want to start though with this slide that just briefly brings our attention to the following, that we are now 2 decades plus into the Genome Project, which has said to us that we are all genetically 99.9% the same. That means then that race is definitely not a biological construct, it's a social construct. And that all of the stuff that we hear about, you know, the physiologic differences between us that account for the differences in health outcomes should be thrown out the window. The point is that it's the way we've structured our communities and our societies that have created these racial disparities. So we need to understand from the very beginning that they are not natural, that we have made it this way. So let's review some of the data regarding maternal mortality. First, by definition, a pregnancy-related death is defined as the death of a woman during pregnancy or within 1 year, the end of pregnancy from a pregnancy complication. If we look at some of the clinical causes for those pregnancy-related deaths, we can see those here, where heart conditions, infection, hemorrhage, hypertension, thromboembolic phenomenon are some of the most common causes. It's also important for us to understand that relative to other industrialized countries, the United States is among the most dangerous places for women to give birth. Having recognized that, it's also important that we understand that the maternal mortality rate in our country has been increasing. And so you can see here from 1987 through 2016, the steady rise in the rate at which mothers die related to giving birth. This slide looks at data divided by race for maternal mortality. And it's important for us to appreciate that the higher the number, of course, the worse the rate. So African-American mothers have the highest maternal mortality rate in the country, followed by Native Americans and Alaska Natives. This is the overall maternal mortality rate. The green here is the white maternal mortality rate. The red is the Hispanic, and this is Asian Pacific Islander. About 700 women a year die from pregnancy-related causes. Significant in that number is that we think 3 in 5 of those are preventable, that they don't have to happen, that with appropriate care and intervention that we can avoid those deaths. Of those deaths that occur, about 1/3 occur during pregnancy, about 1/3 at time of delivery or within 1 week of delivery, and about 1/3 occur between 1 week of delivery and 1 year postpartum. Here's where the issues concerning the disparity are highlighted. The Black and American Indian, Alaska Native women are about 3 times as likely to die from a pregnancy-related cause as white women. Ohio happens to reside in what's considered perinatal region 5. Minnesota, Wisconsin, Illinois, Indiana, Ohio, and Michigan are the 6 states that make up perinatal region 5. And we'll highlight some of that data briefly, both where maternal mortality and infant mortality is concerned. So this looks at the United States maternal mortality rates by race. And what I've highlighted here is the national disparity between Blacks and whites. If we look at the state of Illinois, we see that Black mothers die at 3.3 times the rate of white mothers. In the state of Indiana, 1.7 times. In Michigan, 1.8 times. And in the state of Ohio, essentially 2 times. This is a 5-year aggregate of data, so it's a pretty good snapshot of what's going on in our various states. Let's turn briefly to infant mortality. By definition, infant mortality is the death of any live-born baby prior to his or her first birthday. So it's important for us to appreciate and understand that as we look at the infant mortality rate, we are not including abortions, miscarriages, or stillbirths. As important, please appreciate that the infant mortality rate internationally is considered one of the most sensitive indicators we have for a group's well-being. Infant mortality rate also serves as a community mirror, so it tells us something about where we live and our commitment to protect the well-being of our very youngest and most vulnerable. Health and Human Services has a committee called the Secretary's Advisory Committee on Infant Mortality. And in 2013, they reminded us that the contributors to why babies die during the first year of life are multifactorial, that it's not just about high quality healthcare, but as you can see, 2 through 5 on this slide that remind us that the social determinants are very important contributors. And that as such, our ability to prevent infant deaths and to address longstanding disparities in infant mortality rates between population groups is a barometer, a measure, if you will, of our society's commitment to the health and well-being of all women, children, and families. So with that as backdrop, let's look at some of our national data. This covers actually a 40-year period of time, so a long enough period of time that it gives us a look at reliable trends. And in the United States of America, from 1980 through 2019, we have improved or decreased the infant mortality rate by 55%. That is awesome. And so we have participants applauding that significant improvement. In February of this year, the Director of Maternal Child Health Bureau for HRSA published this article that talked about the importance of accelerating the rate at which we decrease the infant mortality rate in our nation so that we have an opportunity to achieve health equity in infant mortality by 2030. What that article tells us is that in 2019, there were nearly 21,000 infants who died during the first year of life. But to put that in perspective, what they said is, let's assume that there's a jumbo jet that carries 400 people when it's totally full. And that 21,000 infant deaths in 2019 would be the equivalent of a jumbo jet crashing every week for an entire year. Now, I think that in the real aviation industry, we would never consider this acceptable, but it's what goes on year after year after year in our country for saving the lives of babies in our nation. And unfortunately, there's this significant disparity in the opportunity to survive the first year of life. So this looks at this same 40 years worth of data, where here we've disaggregated by race the Black infant mortality rate, the much higher rate compared to the white infant mortality rate on the bottom. We'll get rid of the blue line and show you that there's been a persistence in this gap in the opportunity to survive the first year of life by race in our nation, and remind you of that statement made by the Secretary's Advisory Committee on Infant Mortality, that the persistence in this gap says something about our commitment, or should we say lack of commitment, to assuring the health and well-being of all women, children, and families. Another characteristic of that same data set that I'd like to highlight for you is what's referred to as the disparity or the inequity ratio. And here's what we mean by that. In 1980, Black babies died at 2 times the rate of white babies. We see this disparity ratio of 2.04. Even though the Black and the white infant mortality rate decreased over the subsequent 40 years, the disparity ratio increased. So we see in 2019, Black babies died at 2.5 times the rate of white babies. That occurred because the pace of improvement, the pace of decrease in the infant mortality rate was faster for whites than for Blacks. And so as a consequence, the disparity ratio went up. Our goal, our interest is to eliminate those disparities. So I digress for a second to show you this Running Man slide with the following concern. If we want the runner who is behind to eliminate this gap and catch up with the runner who was in front, and we want to do that without the runner who was in front slowing down so the runner who was behind can catch up, then I think all of us understand that the only way to do that is for the runner who was behind to run faster than the runner who was in front in order to eliminate this gap. So it is with infant mortality and with maternal mortality. We need to figure out a way to eliminate the Black-white gap in the opportunity to safely give birth and to survive the first year of life. And we need to do it, first off, without slowing down any of our efforts to decrease the white maternal and infant mortality rate by as much as possible. But then we need to quadruple, triple down our efforts for African Americans in our country so that we can eliminate this gap. Now, I've given various versions of talks like this throughout this nation, and that notion of working harder to decrease the infant mortality rate and the maternal mortality rate for Black patients at a faster pace than for white patients bothers a lot of people. They say that it is immoral, unfair, and unjust. But look at our own data. We've been doing that for decades in this country, and we've been behaving as if it's okay, as if it's normal, because it has benefited whites significantly more than for Blacks. The next piece of this same data set that I want to bring your attention to is what I call a crude survival time lag. You won't find this in the literature. This is something that's been created by me, but here's what I want you to understand about it. Again, recall that we're looking at 40 years worth of data, so long enough period of time for data to give us reliable trends. And if we look at the most recent Black infant mortality rate in 2019, where Black babies died at 11 out of every 1,000 Black births, we have to go back in time 40 years to find a comparable white infant mortality rate. Now, if we don't change this trend, if this trend or pattern stays the same, then what the United States of America is telling people who look like me is that our babies have to wait another 40 years or until the year 2059 to experience the same opportunity of surviving the first year of life as white babies did in 2019. Now, we think that's unfair, and we know that we can do better. The next characteristic of the same data set that I want to look at is how we've done in terms of achieving healthy people goals. As you all know, every decade, the United States of America establishes goals, health goals for itself for the subsequent decade or the subsequent 10 years. And let's see how we've done in this country by Black-white race in terms of achieving those goals. So a lot of data on this slide, but please allow me to walk you through it. For Healthy People in 1990, we said that by the time we got to 1990, we wanted to have an overall infant mortality rate of 9 deaths per 1,000 live births and a Black infant mortality rate of 12 deaths per 1,000 live births. We achieved that overall infant mortality rate for white babies in the United States in 1986 in advance of the goal date. For Black babies, we didn't achieve this disparate infant mortality goal until 20 years later. For Healthy People 2000, we said that by the time we got to the year 2000, we wanted to experience an overall infant mortality rate of 7 deaths per 1,000 live births. We achieved that goal for white babies in 1992, 8 years in advance of the goal date. For that goal for Black babies of 11 deaths per 1,000 live births, we achieved that 17 years after the goal date. For Healthy People 2010, we said, let's do away with these disparate goals by race for surviving the first year of life. So we had one goal. We wanted everybody's infant mortality rate to be no greater than 4.5 deaths per 1,000 live births. That was an aggressive goal. We did not achieve it overall for this nation until 2019, 9 years later. We just finished Healthy People 2020, where we said that by the time we got to the year 2020, we wanted one goal infant mortality rate of 6 deaths per 1,000 live births. We achieved that goal for white babies in the United States in 1995, 25 years before the goal date. What you can see here is a nationally well-established, racially determined pattern for achieving Healthy People infant mortality goals, where we achieved 3 out of the 4 Healthy People infant mortality goals for white babies, and we did so in advance of the goal date. For Black babies, we achieved 2 of those Healthy People infant mortality goals, but only when the goals were disparate for Black babies, and we did so well after the goal dates. Now, understanding how these patterns work is very important, because if, for example, I ask you to tell me the next number after 2, 4, 6, 8, everybody would tell me 10. Or 5, 10, 15, 20, everybody would tell me 25. And you understand that because of the pattern that's established by the numbers preceding the query. Think about that where infant mortality is concerned and the patterns that have been well established in this nation on the basis of race. Ohio resides in perinatal region 5. I mentioned that during our discussion of maternal mortality rates. The darker the state is in this slide, the higher the infant mortality rate. And this looks at Black infant mortality for the entire country for a 3-year aggregate period of time of 2011 through 2013. And you can see concentrated here is that the Black infant mortality rate is higher in perinatal region 5 than in any other perinatal region in the country. As a matter of fact, if we look at perinatal region 5, the states that make up perinatal region 5, compared to all other regions where Black infant mortality is concerned, you can see that the Black infant mortality rate is higher, with the exception of Minnesota. But keep in mind that Minnesota has the largest population of Somalis in the nation, and the Somali infant mortality rate is included in the Black infant mortality rate. If we disaggregate that the Somali population out of the Black infant mortality rate, we can see that Minnesota's Black infant mortality rate is as high as all of the other Region 5 states. Recognizing this pattern for Region 5 is important because most people think that the Black infant mortality rate is highest in the southern states. And while the southern states do have high Black infant mortality rates, the area of the country where the Black infant mortality rate is worse is in Region 5. So if you look at our Region 5 states and then we pose the question, how many babies would we save? How many Black babies would we save if the infant mortality rate in these states for Black babies was the same as it was for white babies? And you can see the numbers here. Overall, we lose 30 classrooms of Black babies every year in this region because of the disparity and the opportunity to survive the first year of life. And so we really do have to make a change here. It's important that we address this issue. And so I'm so grateful to be a part of this panel. Nelson Mandela taught us that it always seems impossible until it's done. Thank you all very much.
Dr. James, thank you for sharing that information. It's very sobering and important, and it really gives us the foundation when you layer on the impact of clean air and climate, which the most vulnerable populations are pregnant women and young children, as well as senior citizens. It really is very helpful to us as we're thinking about this context as we continue with our conversation. And one of the things that we also know that as we're looking at clean air, we're looking at how that impacts children's health, it's helpful to know what some of our mothers who are members of Moms Clean Air Force and activities that they're engaged in. And we're very fortunate to have with us today Ms. Katrina Blassingame, who is a Moms Clean Air Force super mom, meaning that she's a person who really is a great spokesperson. She is a mother of 4 and very interested in how to take action and how to raise awareness in our community and with our lawmakers. So I want to turn over to the audience for a moment to have Ms. Blassingame tell us about her thoughts and her passion and how she's come to this action oriented towards clean air and towards protecting children's health, and to talk just a bit about some of the ways in which she's been involved. Ms. Blassingame.
Thank you for that introduction, and thank you for inviting me to be a part of this panel. I am a mother, and my daughter, who is 17 and a junior in high school, Rain, has suffered from asthma since about the age of 4. Now, we are a very active family. We believe in extracurricular sports from a health and wellness standpoint. So health and wellness is very important to my family. And so having a child with asthma, it has been very challenging for her. As you can imagine, participating in a sport my main question to her would always be, can you breathe? Are you breathing okay? I would have to watch her closely, the rise and fall of her chest, to see if she was breathing differently than any other activity. And she began to be able to tell the difference between if she was just out of shape at the beginning of a sports season or if it was actually her asthma. So it's pretty scary as a parent to have a child with asthma and have to ask constantly, can you breathe? So, our life looked like taking our inhaler with us. And when she was younger, not being able to take the inhaler in her mouth, so we would put the little mask over her face so that she can receive the medication. And at home, we kept the nebulizer in her room for treatments before going to bed or treatments in the morning. And we would take it to school so that her teachers could give her treatment in the middle of the day if she was having an episode with asthma. And we wanted her to continue to participate like normal kids during the school day. We didn't want to have to keep her at home to provide the medication with her, so we would send it to school. So because of those experiences, that's what encouraged me to become a part of Mom's Clean Air Force. So it has given me knowledge and a platform to really talk about the need for the clean air solutions for our children and to advocate for electric school buses. We know that our kids are in school 5 days a week, that they are in school 8 to 9 months out of the year. School buses are the major transportation for kids getting to and from school. So we know that reducing the pollution from diesel fuel is from the environment is health for our environment and a health concern for our children. We don't want school buses polluting our communities as they're picking up our kids for school, or polluting our community as they're bringing the kids home from school. So this platform has allowed me to really advocate for the need for electric school buses for clean air quality, because we want all children to have the ability to lead a healthy lifestyle, which is a main concern for our family. So having a child that even now still participates in outdoor sports, soccer, track, also indoor sports, air quality is important to us. And I am so thankful for the platform for Mom's Clean Air Force to allow me to speak openly and passionately about our need to clean up our environment. And we know that also that, the effect of poor air quality on kids like my reign, it's important that we act and we act now.
Thank you so much, Ms. Blassingame. It really is helpful to both think about the information that was just shared with us by Dr. James, and then to think about a family and a child who are impacted, in this case by asthma, and how this all relates back to clean air and to children's health. And thank you for sharing with us the reason why you have become involved. And now I want to turn to Representative Hicks Hudson. Representative Hicks Hudson is the Ohio representative for District 44, which includes Central Toledo. And among her many leadership roles, she's the co-chair of the Ohio Black Maternal Caucus. Welcome to you, Representative Hicks Hudson, and we'd like for you to share with our audience today some of the reasons why these issues are important to you.
Well, if I can begin by first of all saying thank you for this opportunity to be a part of this panel and to learn from Dr. James some of the information that you have anecdotally, but now you can look at actual data to back up what we know to happen to our moms and to our children in our communities due to environmental social determinant issues. And I was really surprised by what Mrs. Blassingame said when she talked about asking for school buses to be not diesel, but to become electric. And there's a move at the State House to try to, there's a bill being introduced that looks at how to move our state vehicles to that electronic or electric platform as opposed to gas and diesel. So its time has come. And so as the co-chair of the Black Maternal Health Caucus in our minority caucus group, we are focused on how we can learn about what's happening throughout the state of Ohio and become those advocates at the State House to introduce legislation, to raise awareness about some of the policies and practices that are happening, that are being implemented by the legislature, that are not moving the needle, or in a way in which we can actually provide some type of relief for the challenges that are facing so many of our moms and our children within our community. For me personally, I serve a district where the levels of infant mortality and maternal mortality are extremely high. And that is unfortunate in this day and time with all of the resources that we have, that we still have not moved that needle. My goal in being a legislator was to work on ways in which we can improve the health of our citizens, old, young, man, woman. And in doing that, I think we can begin to address those concerns that were raised by Dr. James in his presentation. For me, our caucus is looking at ways, and what we've been doing since we've started back up is really talking and listening to folks throughout the state of Ohio who are the experts in the field, listening to what they have to say about what they're doing and what are their needs that are not being met by legislature, by funding, et cetera. And that's so important that we have data, that we're able to target that data, legislation, to say that based upon what we know now, we need to put our resources to address this issue, and we can address it by doing these particular things. And so I believe that the caucus, as we move forward into the end of this legislative session and moving forward into next year, if everything works out, that I'm able to return. I will be returning to the Senate as opposed to the House, but I will be definitely still a part of this caucus because it's vitally important that we raise awareness, we provide that type of strong information to justify and to advocate for those who look like you and I.
Thank you so much for those comments, Representative Hicks Hudson. I'd now like to turn back to Dr. James for a moment. I have a question that I would like to ask him. Now, after listening to your presentation about what I can only say to me seems to be a shocking state of the health status of women of color and in terms of mortality and morbidity, there's one question that rarely may come to the minds of our viewers, and that is, what is the cause for this significant disparity in health status with other racial groups? And is that cause related somehow to the women themselves?
I think it's an excellent question. Thank you for asking it. There's several ways that I'd like to respond to the question. First off, because there's been emphasis on the state of Ohio in this panel, I want to mention a couple of other statistics regarding the state of Ohio. This is regarding infant mortality. For the last 5 years for which we have national data that allows us to compare states by race, so 2015, 16, 17, 18, and 19. For each of those years, the state of Ohio's Black infant mortality rate has been the second worst in the nation for all 5 years running. And Black babies in the state of Ohio die during the first year of life at 2 times the rate that Black babies in the state of Massachusetts died during the first year of life. Think about that. Because even if you try to make the argument that Black people and white people are so significantly different that accounts for the racial disparity in birth outcomes, we're talking about comparing Black to Black for Massachusetts and the state of Ohio. And if you're Black and born in the state of Massachusetts, you have a more than 2 times opportunity for surviving the first year of life than you do in the state of Ohio. I point that out because it's important for us to appreciate that the reason for the disparities has nothing to do with group level flaws amongst those of us who are Black. It has nothing to do with white people being better than Black people. It has to do so significantly with how we've decided to organize ourselves, how we've decided to put our societies together. And that's a piece that gets to be extremely important, because as we look at solutions, the tendency is to try to only address what occurs in the clinical realm, where so much of the answer to this is non-clinical. It happens where we live and the conditions that we've been subjected to because of racism in this country and in the state of Ohio in particular. And until we get to a point that we're willing to also address that, we're not gonna solve this problem.
Thank you, Dr. James. I'd like to now turn a question to Ms. Blassingame. And I was thinking back on your comments when you're talking about your family and your 17-year-old daughter, Rain. And I wondered, when you consider your daughter Rain's experiences with asthma, when did you make the connection between her asthma and either pollution in general or diesel tailpipe pollution from her riding diesel fuel school buses?
Actually, I didn't make the connection until recently. There was not a lot of information stating that the pollution from the diesel fuel was a trigger for kids with asthma. Not until I joined Moms Clean Air Force and the great work that Moms Clean Air Force is doing with providing information to the public that I become aware that maybe that was a trigger. We did know that she would have flare-ups of her asthma in the fall of every year. So thinking back and knowing that she was in school during those times when she would start to have her flare-ups, that the possibility of the diesel fuel, the poor air quality around the school and in the community, once schools started back up with the amount of transportation that the school buses provide, did we begin to make the connection.
Sometimes we don't realize that this is a process, and that as we learn more and know more, then we can be more responsive to the facts and situation. Let me turn back to you, Representative Hicks Hudson, and one of the things I would like to ask you about is for you to tell us more about the Ohio Black Maternal Health Caucus and some of their, you mentioned some of the work that you're doing, but I was wondering if you could tell us just perhaps a few more specifics about the work of the caucus.
Sure. As I said, the caucus has been working to really just to gather information about what's going on around the state of Ohio. But we also, as members, have worked on raising the awareness. So during the month of April, we hosted various activities around Black maternal health through mostly by Zoom, is what like we're doing now, which was a great opportunity for people throughout the state of Ohio to be able to have access to that platform. Additionally, we are looking at legislation. There are different members of our caucus that have proposed different types of legislation. I've been working with a couple of my colleagues on ways in which we can improve the outcomes for moms, young moms in particular, where they don't have to, they're underage, they don't necessarily need to have parental permission for going to see a GYN or OB/GYN doctor early on so that they can be healthy. We're looking at other pieces of legislation that will work on improving cultural sensitivity by practitioners and providers, so that, Black women in particular don't feel that when they raise a complaint that it's being dismissed, and all the stereotypes that are still attached to being African-American and being a woman in this country and in the state of Ohio. So what our caucus is doing is we're looking to make sure that the types of legislation really are addressing the needs, and not, sound bites, or not pulling in things from a national perspective that don't fit what's happening in Ohio. And that's what I think is most important, and how our caucus is a little bit different than some of the other caucuses. We may look at legislation that's on a national level, but we're also looking to see how does it fit and how does it work within the framework of the state of Ohio. And, we're up and running. We've had some spits and starts because of COVID. And then now, as I said, with the election cycle coming up, we're going to continue to do what we said we would do this year, which is to gather information, be stronger coming out the gate for the next legislative sessions.
Having heard what your caucus is doing, it makes me want to go back to Dr. James for a moment and ask you if you have any recommendations that you would like to make in terms of trying to help the rest of us in reversing some of this trending of the morbidity and mortality rates, in addition to the types of actions that Representative Hicks Hudson has just mentioned.
Yeah, I think that the intervention efforts that we need to be involved in are multifaceted. But I'm gonna again preface my comments with another data point for the state of Ohio to help you appreciate the dire circumstances that we are in our state. And this time I want to focus on Cuyahoga County with the following to put us in perspective. Throughout the United States, I showed you data that shows that Black babies die at about 2.5 times the rate of white babies. In the state of Ohio, Black babies die during the first year of life at 3 times the rate of white babies. In Cuyahoga County, which is a county that is a worldwide destination for clinical care, Black babies in the first year of life die at 4 times the rate of white babies. And in the city of Cleveland, Black babies during the first year of life die at 7 times the rate of white babies. If we look nationally at all large cities in this country, the Black infant mortality rate from 2016, 17, and 18, so a 3-year aggregate period of time, the city of Cleveland has 1, the highest Black infant mortality rate in the nation, 2, has the largest Black-white difference in the opportunity of surviving the first year of life as any city in the state of, in this country. And so there are some special problems in this state that have to be addressed. And so I'm so glad, Congresswoman, that you're a part of this panel, because we need intervention in terms of policies, practices, and systems statewide, but also locally. I also think it's essential that we get grassroots level community educated and involved in efforts to resolve these problems, because until we get to a point that we are able to speak up for ourselves, I don't believe anything is going to change. In the interim, despite all of the encumbrances that exist in the system that has perpetuated these disparities, we need to make sure that we're getting involved in care as soon as possible once we determine ourselves to be pregnant. That if we have things that we are doing that we know can contribute to compromised outcomes, like smoking, drinking, using drugs, we need to work on stopping. But more importantly, at the community level, long-term, we need to work on policies that elevate the social determinants so that we are no longer living in a situation where our zip codes determine our health outcomes more than our genetic code does.
And Dr. James, I just have to join you in those comments, and also to bringing that point back to the concerns that we have about the impact of climate change and extreme weather and heat, which are known factors to exacerbate any other health condition that a pregnant woman may have, and the disproportionate impact of extreme weather on communities of color, taken with the information that you've just said, along with the fact that you also mentioned that we need to make sure that there's active grassroots activity and communication with our elected officials. I want to ask one last question then to Ms. Blassingame. And I wonder if you could tell us if you have any advice as a mom for other parents and caregivers whose children have asthma, about what are some of the actions you would recommend that they take?
Yes, first and foremost, let your elected officials know that you care about clean air, that you advocate for electric school buses. Pay attention to the air quality of where you live and advocate for solutions to clean up the environment where you are. I would say in a school sense, I would advocate for my child at school who has asthma not to stand outside and play outside where the school buses are. Maybe they're the last ones that would get on the bus. I would ask that the schools have our carpool parents that arrive early not to sit with their cars idling. And just be aware of your environment and where you are, and be an advocate.
Thank you so much, Ms. Blassingame. And I feel that I should kind of have a bit of a equal opportunity time to Dr. James and Representative Hicks Hudson, because we're about to wrap up. And I just want to know if either of you have very quickly, in a minute or less, one last comment that you would like to say to our audience in terms of a difference that each of the members of the audience can make.
Yeah, I'm, as I said earlier, grateful to be a part of this panel. I want to especially pat Ms. Blassingame on the back, because we need more parents to be advocates like you are in this effort. And it's not only school buses. You know that when our highway system was built, they intentionally built those highways through predominantly communities that brought more vehicle exhaust into our communities. And so we see nationwide an increase in the incidence of asthma and emergency room visits from Black children compared to white children, in part because of that. Also, the locations where the school buses are kept when they're not running are preferentially in communities of color, so that the level of exhaust is higher. So your advocacy is extremely important, and I applaud you for your involvement. Likewise for our Congresswoman and for the wonderful work she's doing both in Toledo and at our State House, because we need this issue to stay front and foremost, especially in the state of Ohio.
Well, with that, I just want to thank our panelists for their thoughtful comments. And I also want to acknowledge Tracy Sabata, who is the Moms Clean Air Force State Coordinator, for helping bring you, the audience, this conversation. And now that you have had an opportunity to learn more about Black maternal health and clean air and climate and health equity, please don't stop there. Stay engaged with your local, state, and national elected officials. Contact Moms Clean Air Force and take action to assure that there is justice in every breath. Please join us for our next conversation in June 2022. We will be discussing clean air, climate, health equity, and inequity, and its impact on Indigenous and tribal communities. And immediately following the close of our conversation, we're going to be displaying some important information that we would like you to know more about, a fact sheet on health equity, and also information about activities that the Ohio Moms Clean Air Force are engaged in supporting legislation involving Ohio Energy, the Ohio Energy Act. And with that, again, I want to thank our panelists and thank our audience. It's really been important that we have this conversation and that we try to get information out to our community and to the public so that we can have justice in every breath. Thank you, everyone.
Thank you.
Yeah.